Hi, this is Taina with Honeybyt, where I condense sweet, bite-sized wisdom. Today, I'm summarizing the Mel Robbins podcast, number 157. It's all about menopause. She has Dr. Marie-Claire Haver as her guest, and she is a renowned gynecologist and obstetrician and is also part of the Menopause Society. In this podcast, she's sharing how to lose belly fat, sleep better, and stop suffering. Doctors overall receive very little training when it comes to menopause. If you go to PubMed, which is like the Google for health professionals, you find 1.1 hits in regards to pregnancy, yet only 94 in regards to menopause. So menopause receives only 10% of the funding, and that concerns like half of the population. All women go through it, and most women spend 1/3 of their lives in a post-menopausal state. When we're born, we have about 1 million eggs in our ovary. By the age of 30, we only have 10%. By 40, we only have 3. And by the age of about 51, we have no more eggs left, and the ovaries stop producing hormones. The word menopause means it's the day 1 year after our last menstrual cycle. After that, we're actually in post-menopause. Before that, when there's spotting, etc., that's called perimenopause. So if you're doing what you've always done, but all of a sudden your pants do not fit, you have ADHD, you have brain fog, you cannot sleep, well, it's mostly because of your hormonal imbalance. Hot flashes are really the only symptom that can be connected with menopause alone. All of the other symptoms are often treated with other medication. Estrogen is an anti-inflammatory hormone. So it really helps with the kidney function, lung function, brain function. And we do know about osteoporosis. And osteoporosis happens because our bones are constantly being chewed away and being rebuilt. However, without estrogen, the rebuilding of the bone is not happening as it did before. And so our bones become brittle and porous. However, osteoporosis is really only recognized when it's too late, meaning when there is a fracture. So estrogen really helps with keeping the bone density high. Isn't that a cool fact that you do not have the same bones now that you had when you were younger? The genital area and the urinary system are highly sensitive to estrogen. So with the drop of the estrogen, our parts are losing their elasticity and their flexibility, which can sometimes result in painful intercourse. The most effective treatment for a UTI in a postmenopausal woman is actually vaginal estrogen and not antibiotic. Weight gain around the stomach area is happening because the body wants to produce estrogen, and estrogen is also in part produced by fat cells. So the body holds on to the fat, trying to produce more estrogen. There's only 5 animals that go through menopause, and 4 of them live under the sea, like the beluga whale. We were not designed to live without hormones. Really important to aim for a strong body, not a slim one. Start weight training. It's really beneficial, and it will keep us strong and also balanced. Balance is also super important. Have a good sleep hygiene. No phones in the room, dark room, early bedtime, no alcohol, ideally before going to bed, because we are processing alcohol differently now than we did when we were younger. So we have the choice of having drinks before bedtime or having a really good sleep. Doesn't really work together. To summarize, hormones increase the quality of our lives and the functions of most of our organs. Dr. Haver is part of the Menopause Society. Check out their website to find a provider that will help you with your menopausal symptoms, or you can check out Dr. Claire's book, The New Menopause. And this was a summary of Mel Robbins podcast number 157. My name is Taina. Thank you for listening to Honeybyt's sweet condensed wisdom. Please subscribe, and I hope you'll be inspired.